Today, I will teach you about the causes of chronic cough. So, there can be intrathoracic causes or extrathoracic causes. What are the intrathoracic causes? So, COPD is first, then comes asthma, lung cancer, tuberculosis, bronchiectasis, left heart failure, interstitial lung disease, cystic fibrosis, and idiopathic cough. Then, what are the causes of extrathoracic cough? So, because of chronic allergic rhinitis or PNDS, which is post-nasal drip syndrome, or UACS, upper airway cough syndrome, or GERD, or due to medication like ACE inhibitor can cause extrathoracic cough.